Hello, everyone. We're delighted that you could join us for this webinar on using National Poll on Healthy Aging data. My name is Jeff Colgren. I am director of the University of Michigan National Poll on Healthy Aging. The National Poll on Healthy Aging was launched in 2017 and is directed by the University of Michigan Institute for Healthcare Policy and Innovation. It is sponsored by AARP and Michigan Medicine, the academic health system of the University of Michigan. As many of you know, the National Poll on Healthy Aging field surveys twice a year to a national sample of over 2,000 U.S. adults aged 50 to 80. In these nationally representative surveys, the poll covers a wide range of topics related to health and healthcare for older adults and is a valued source of timely information on the perspectives and experiences of older adults around some of the most critically important health policy issues of our day. During this webinar, National Poll on Healthy Aging data lead Matthias Kirch will provide an overview of the poll, share examples of how poll data have been used, and offer tips and answer questions about accessing and using poll data. Matthias will specifically highlight the data now available in National Poll on Healthy Aging Wave 8, newly released through the National Archive of Computerized Data on Aging's Open Aging Repository. Thank you for joining us. I will now turn it over to Matthias.
Hello, thank you for joining us. So as Jeff mentioned, the National Poll on Healthy Aging recently released our 8th wave of publicly available data. We've had data that we've collected from 2017 until 2021. That's all now available online. So we're going to talk a little bit about that today and how you can access that and hopefully answer some of your questions. So as Jeff mentioned as well, the NPHA has 3 main goals. So one of the most important goal is to develop a recurring nationally representative sample of older adults. We intentionally include a wide range of adults from 50 to 80 to kind of keep both people who are older and retired age, but also people who are approaching that age to kind of get their perspectives on aging, their thoughts about how they might prepare for that. We disseminate our results through multiple channels. And one thing that's really unique about the National Poll on Healthy Aging is that we have a really wide audience. We are looking not only to reach out to, your kind of normal suspects like researchers and healthcare professionals, but also policymakers and also older adults themselves and their families who might be interested in this work. So my role on the poll is the data lead, and I take part in both the planning of the survey questions and the analysis of these. So we have used 2 different survey vendors during our time conducting polls. And right now we're using NORC, which is their AmeriSpeak panel, but all of the data that were released up until now, which was the April 2017 through January 2021, uses Ipsos's knowledge panel. So a lot of the questions we get about NPHA are about this sample, right? So, obviously we're not collecting our sample ourselves. We're using a panel that already exists. And for a lot of people, they wonder, okay, how do we know this is nationally representative? The thing that both Ipsos and NORC do is they use a mail-based sampling frame. So unlike, a only online survey, which would just like put out things to anyone who would happen to find it on the internet, this is directly targeting folks based on where they live in the US so that they can have a representative sample across all 50 states and from multiple age ranges and other backgrounds. The survey, as we mentioned, fields twice a year to about 2,000 people ages 50 to 80. We have half of those every time are ages 50 to 64 and half are ages 65 through 80. The sample is then weighted to reflect the US population of that same age. And it uses the current population survey as estimates to weight it to represent that sample. So when we talk about completion rates, we actually have a pretty good rate of completion, 60 to 70% among panel members who are contacted to participate. This means that of all the people that we contact every time, that's how many decide to complete it. It's not the same exactly as a response rate, where we have to take into account, how many people were selected to participate in the sample to begin with. And then of those, how many decided to be on the panel. So there's a couple different stages. And I think our final response rates are going to be quite a bit lower. That's all in our documentation that you can find. But in terms of when we reach out, we get about 60 to 70% of people actually completing the survey every time. And all of the surveys that we've completed through the knowledge panel from Ipsos were done completely on internet. Our newer surveys using NORC's Amerispeak panel also include about 10% of the sample who uses phones to complete the survey. So NPHA has covered a wide range of topics. We have over 50 reports out now, and they cover really, a very expansive range of topics about health. So, we have everything from kind of prescription medicine and telehealth and talking to your doctor about different conditions to other things like sexual health and preparing for emergencies and people's comfort with using different types of technology such as patient portals and telehealth. All right, so one of our goals when we first started doing this was to make not only our reports and research available widely throughout the policy world, but to make our data also available to people who would like to do data analysis. If you go to our webpage, we now have all eight waves that are available will be on this page here. These are all hosted through NACDA's Open Aging Repository. On our page, though, you can get a pretty good sense of what's available. We have, for each wave of data available, the topics that are covered, a list of the topics, and we have a survey, the survey questionnaire itself that you can download and look at to see exactly what questions we ask for each wave. On NACDA's site, there is a wide range of data, and NPHA is just one of these data sources. But you can search here for data of all types. They've been really great partners to work with as we have made this data available. So I'm going to talk a little bit about our newest data release, which is Wave 8. We covered 5 main topics in this, 5 reports that we got out of it, including alcohol use among older adults, physical functioning and falls during the COVID-19 pandemic, saving for future healthcare expenses, home blood pressure monitoring, and mental health. In addition to these 5 reports, we also had 2 what we're calling poll extras based on just a couple of questions that we asked. One about people getting pets during the pandemic, and then looking at older adults' attitudes towards the COVID-19 vaccine. This was in January of 2021, so it was a little later into the pandemic, and we had information from a couple of time points by then about people who had attitudes towards the COVID-19 vaccine. In poll 8, we also have additional data elements, including demographic, health, and household variables. The ones that you see here highlighted with a star are ones that we asked directly, and then the other ones are provided through our panel through Ipsos. So this ranges from, we have information about gender and race and ethnicity, marital status, and region of the country. The smallest geographic unit that we have available is state. We also include questions that we asked about health, about physical, mental health, people's experiences of loneliness, and delayed healthcare use. And we also have a list of health conditions that people have said that a healthcare provider has told them. That comes from our vendor as well. For household questions, we have the number of adults and children in the household. We asked a question about pets, as I mentioned, and some questions about caregiving, as well as household income. All right, so I'm guessing the reason that most of you here is because you are interested in using the NPHA data. So I'm going to give a little bit of an overview of what you can expect if you want to download our data. And then I'm going to open it up for some questions from you all that will help us understand better how you might use our data and what kind of things we could do to help you use it as you do. So this is what you would see if you went to our site and clicked download the data. So this is the Open ICPSR's kind of interface. And as you notice here, the title of our poll shows up here first, the National Poll on Healthy Aging, and then it has the date. So we now have 8 waves of data out here. And when you click on the 8th wave, it will also link you to all of, there will be a place lower down on here that'll link you to all the other waves of data. We go into a little bit more detail about what's actually on this page. You can see that there are a couple different types of files. We have a .dta file, which is the Stata version of the file, and we have a SAS files, which are the .sas and the V8 export. So those 2 files you can use if you're using SAS. In some previous versions, we also did include an SPSS version as well as an R version, but my understanding is that those programs now you can actually import both Stata or SAS programs directly into that. So we're just including the Stata and the SAS right now, and you should be able to import that into your program that you're using. We don't include the data in like an Excel format, and the reason for this is because all of our data is weighted for surveys, and you wouldn't be able to do a direct calculation of data without applying those survey weights. So we needed it to be in a program format that would support that type of analysis. The other 3 documents here are PDFs, and I'm going to, here we go. These are the 3 PDFs that we include with each one. So we include the survey instrument, and as I mentioned, that's also on our own individual web page. This one really helps you to see exactly what questions we asked. And it has all the coding there as well, so you can see what values each item has. We also can include a survey report. The survey report has detail from our vendor about how the sample was created and weighted, and additional variables that they've included with us. So that would have, our survey instrument would have just the questions that we asked. The survey report would have those additional questions that I mentioned, things like demographic variables and health variables. And then finally, we have the code book, and the code book actually describes the data itself. So it shows you for each variable in the data set, what type of variable it is and the values of that variable. And as you can see a little bit on this example here, it actually does include the missing data as well. So one of the nice things about this is it includes everyone that was sampled to participate in here, whether or not they completed the survey. So you can do analysis as well for the non-responders. All right, so as I mentioned, you'll need a stats program to analyze the data. So I have used Stata pretty exclusively to do it, but SAS, R, and SPSS will also work. There are other data programs that you can also use survey weights with. You know, if there's something that you were thinking of using, feel free to drop it in the question Q&A, and we can look into that and how we might help provide that data for you. All right, so kind of going back to why you need a survey, a stats program is because of these survey weights. So as I mentioned, the sampling frame is the whole US ages 50 to 80. And we want to make it as representative as possible of that whole population instead of just, 2,000 random individuals. And so the weights are put in there to help get us back to a representation. So if someone, if there's certain groups of folks that are overrepresented, and this happens even just with age, right? Because we like to get an even number of people who are the younger age group, the 50 to 64 and the 65 to 80, but there are actually more people who are younger than older. So the older folks are going to be weighted down a little bit compared to the other ones when you look at everyone together. But if you look at just the older folks, then they would have that weight. So we actually, each of our data sets has 3 weights in it. This example shows weight one. Weight one weights to the whole population, which is ages 50 to 80. Weight two is just that younger population. So if you were only interested in looking at people who are 50 to 64, you would use that. And weight three is just the older population. And there are some survey modules where we only ask the questions of one or another age group. So those, you would want to use those correct weights for. And the survey documentation should answer all the questions about which ones to use, as well as the instrument itself will tell you which age groups were. These weights are a little different maybe than some other weights you've used if you've done survey work in the past, because you'll notice we don't have a strata variable. This was a stratified analysis, but they create a single weight for us when they give it back. And this is what we've used for all of our reports and publications as well. So I think that it works pretty well. Obviously, you'd have a slightly different version of the confidence intervals and other variables like that if you were using a straight up vote. I think that this is a pretty good representation. All right, so some questions about, these are maybe some of the biggest questions we have, and then I'll turn it over to you for some individual questions. How has NPH data been used before? So obviously we have our reports, and as I mentioned, I think we've had 53 reports total released. It might be 54 now because we just had one come out. And we've also had over 20 academic articles published, as well as a number of presentations that we've given, poster presentations and sessions like that. All right, so I'm going to turn it over to Q&A, and I'm going to invite my colleague, Erica Solway, to join me.
Great, and we thank you very much, Matthias. We welcome people to share questions with us that I can ask to Matthias here, and I appreciate that a few folks were able to provide questions when they registered. So we'll start with those, and we'll see if we get to any others as well. So the first question for you, Matthias, is how easily can results be sorted by different age groups?
Sure. So we actually have continuous age available to us. So any questions that were asked of the whole population of 50 to 80, we have their individual ages. So you can sort it into any particular range of ages that you'd like between those two.
Terrific, thank you. And can you say a little bit more about how poll topics are chosen, and if there are certain topics or types of questions that are particularly good for this poll format, or topics or questions that might not be best suited for the National Poll on Healthy Aging?
Sure, that's a great question. So we are really lucky, as Jeff mentioned, the Institute for Healthcare Policy and Innovation at the University of Michigan is the director of directing this poll. And so we have, I think, over 600 faculty members who are part of our institute now, and we ask them to provide us with topics and their expertise. So that's really where most of our questions have come from faculty colleagues who have an interest in older adult health and would like to try out some questions. So in terms of what questions work well, really, we have a lot of really interesting topic areas and a lot of interesting questions that are across a wide range of things. And Erica, you can probably help me think of some of them as well, but I think some of the ones that work really well are topics that are sort of about people's individual experiences and people's opinions about how well things worked for them. Would you say that's true?
I think that's absolutely true. Yep, and probably less so about those things that that people might do or conditions people might have where it's a relatively small number of people that we'd expect given the sample size of about 2,000. So sometimes there's very interesting topics certainly worthy of further research, where the sample size among a group of 2,000 people, adults age 50 to 80, would just be too small for us to be able to explore it in great depth. So perceptions, behaviors, attitudes, ideally that would apply to a large population of people are often the best types of questions or topics to explore through the poll.
And we've had some topics that we started as kind of a poll topic and have repeated over time, like the questions about isolation and loneliness. We've been able to repeat those multiple times, which that started before the pandemic happened, and we were able to see some really interesting trends over time as well.
Great. Thank you, Matthias. And someone's asked about how the race variable is coded in the data set. Can you speak more to that?
Yeah, so this is a really good question, actually. And we currently get the race that they provided to us, which I believe has it's race and ethnicity combined as one variable. So we have, you know, like non-Hispanic white, non-Hispanic Black, Hispanic. And I'm not sure that we have a lot of the other race categories at this point. So I know there was one survey module where we did get some additional race data. It is one of the areas that we're trying to improve. So in our most recent poll that we did, and this data is not available yet, we are actually putting in oversamples of non-Hispanic Black and Hispanic individuals, of having about at least 500 in each of those groups. So it's one of the areas that we're trying to improve as we go forward so that we can have more data to help people do comparisons.
Great, thank you. And then we have a question, or perhaps we have two questions somewhat related. One is the data longitudinal? And another question, can you follow a participant over time? Can you answer?
Yeah, so unfortunately, our data is not longitudinal in the sense of being able to follow the same individual. We don't get identifiers for people. It's very possible that, you know, the same person has completed our survey more than one time, but we wouldn't be able to link it given the data we have. What we do have, and what we've done in the past, is looked at repeat cross-sectional. So we can say, you know, our estimate for the US population of adults age 50 to 80 in 2017 was this versus, you know, in 2018, 2019, 2020. So that's how we're able to do it. But yeah, you can't compare directly over time.
Thank you for that. And as Matthias mentioned, there are several topics that we have asked about over time. And so you are able to look at perhaps changes in attitudes, behaviors, experiences. But again, it's a new sample each time that we field a survey. Thanks for those great questions. Please keep your questions coming. I see we have more coming in. And so, someone asked about, is there a link to the published reports and or a compilation of published articles?
Yeah, absolutely. So we have those available in a couple of different ways on the website, on our poll website, which is healthyagingpoll.org. We have a list of all of our publications, and we also have them listed under each report. So each topic report, we have the individual articles that were published using that data set. We also have them available through the NACDA site. So if you look at each poll wave, that site will have a list, and it should include, this might not be true for the older ones, but it should include like the citation and probably the DOI so that you can link directly to those publications.
Great, thank you, Matthias. And then someone has asked, is it possible to add questions to the National Poll on Healthy Aging?
Yeah, it's absolutely possible. And at the end, I will pull up our email address. We love to hear from people who have topic ideas for us. And if you are someone who is an IHPI faculty member, we would also love to hear from you about possibly collaborating on a poll with you in the future, where you could help us by being kind of our subject area expert and author on a poll and use the data for your own research as well.
And then there's a question, and we've gotten a few questions about specific topics and whether or not they're included in the data that's publicly available at this time. This particular question is about what we know about cancer diagnoses, treatment, and survivorship. Can you say anything more about that, Matthias?
Yeah, so we have not specifically done a module on cancer diagnoses and survivorship yet. That's a super interesting topic though. And if you're someone who's interested in that, we would love to hear from you about some question ideas. What we do have is, I believe in our data that we get from our vendors, we have, were people ever diagnosed with cancer? So that is available as a variable that you could look at other outcomes by in our data sets.
Great, thank you. And then there's a question about if there is a summary of questions asked in more than one wave that's available.
That's also a great question. At this point, no, we don't have that set up quite in that way, but we are exploring some ways to kind of make at least the questions that we've asked over time a little bit more searchable for folks who might be interested in that. So unfortunately, no, right now, we have our individual surveys that you can download and look at, but that's a great suggestion and one we're already thinking about how we can make that happen.
And as Matthias said, we are very available to answer people's questions. So again, he'll get to how you can reach us, but we welcome you to reach out to us if you see something of interest in one of the waves of data and are curious whether it's available in any others. We're happy to help guide you in the meantime as we think about different ways we might be able to present, kind of index our data or make it even more user friendly.
Mm-hmm. And we've had a couple of great examples of folks. I think a couple of them were students who were able to download data sets that were available and either publish on them or use them to write like their theses. So, these data are really, I guess when I think about like in terms of publicly available data, they're on the like more manageable side because it's a single file. It has one code book. You don't have to merge from multiple files to use these. So it's really great if you just, want a pretty straightforward data set to work with to answer some questions.
Yes, absolutely. We encourage people who are instructors or who work with students to really use this as a learning opportunity, in addition to people who are interested in exploring these data for their own professional use, for publishing, that sort of thing. It's really a rich data set. And although we have done quite a bit of publishing, both official NPHA reports, also academic products, there's still a lot of data there that's very much worthy of further exploration.
Mm-hmm.
I want to do a last call to see if anyone else has additional questions. A great question. Do we need to submit proposals to use the data or just download it from the website? Do we need an IRB approval for using these data?
So in terms of permissions from us, you don't need any. The data is out there to be used by the public. And so just, if you have any questions, you can look at NACDA's site for kind of their terms of use. In terms of an IRB application, that really will depend on your institute and what you're planning to do. All of our data is de-identified. And like I said, the smallest geographic area is state, which I believe, makes it, free of PHI in terms of that. But you might still want to like submit one, maybe like an exempt or application or something like that, depending on what you're doing. So I know that we use an exempt application for our own research purposes, and I probably suggest that you at least call your IRB and find out if you should use something like that.
And then one final question we've received so far, Matthias, is, and this is perhaps just a recap, is about it, are these data publicly available and how often are you releasing new data? So you mentioned we just recently released Poll 8. Can you talk about kind of the plan for releasing further waves of data?
Yeah, absolutely. So, we don't really have a tight like deadline necessarily, but we've been releasing these as we develop them, as our collaborators, our faculty collaborators are kind of done with their publications and things like that. And so we've released through January 2021. We're planning to release the next two waves, which will get us another year into January 2022 by the end of this year. So by December of 23, all of the data through 2022 should be released.
Great. Thank you, Matthias. And another question here, a point of clarification about the data being nationally representative. Can you confirm?
Yeah, so this will depend, right? So depending on what exactly you're trying to do with this data, we've certainly had one or two journals who have pushed back on this data being nationally representative. I think I would encourage anyone who wants to use it to look at the publications that we have done and how we described the data, as well as to read the project reports, because they give a little bit more background as to how the data sets are created and weighted to be nationally representative.
That's right. It's a national representative sample with weights that are applied that make it representative for the US population, age 50 to 80. Thank you for that. And then someone asked a question about whether there is a technical paper explaining how to use the data or supporting documentation available online.
So I guess I would turn you toward the project reports. That is really the technical documentation. It will have everything included in there. So for example, when this survey was conducted, the exact dates that it was in the field, when it was, who it was sampled with. So each of these surveys, in addition to having the 2000, that's the data that's available here. We also had piloted them each with a sample of about 100 folks to make sure that the questions worked. So it'll have the dates of that. It will have, a lot of them also have kind of the CMS data that we used to verify the sample was nationally representative. So that data will be in there. Is in terms of a documentation, like how to use it, we don't really have that. But if you have some more ideas about that, I'd love to think about that. If that's something that would be helpful for people, of kind of some examples of like how to use the data or how to think about cleaning it. We don't have anything like that right now in terms of like statistical analyses, but happy to think about how we might provide something like that in the future.
Yeah, I should add that, this webinar today is our first opportunity that we're really having to engage more publicly with people interested in using our data to better understand the types of questions people have so that we can make refinements to our process of, can we share additional information that would make these data even more user-friendly? They are free, publicly available, easily accessible and downloadable, but we want to make sure that any questions that arise for people regularly are things that we can address so that people can use these data as much as possible. There's a question here about whether there are plans to expand the survey to cover people over age 80, which is a great question. And I guess I can go ahead and answer that, Matthias, if you'd like.
Sure.
When we launched the National Poll on Healthy Aging in 2017 and explored different vendor options for fielding the surveys, at the time, most of the vendors that were available could not guarantee national representativeness beyond age 80. The sample size was just getting too small at those older ages. It's something we continue to revisit and hope that maybe it's something we can explore in the future. But given the focus on this being a nationally representative sample, we want to make sure that we're doing that in a way that makes sense when the timing is right, but something that we will definitely consider for the future. And one of the interesting things about this age range, of course, is we have people who are at midlife, not yet in the, over 60 or over 65 age range. And so it gives us kind of a unique opportunity to be looking at health behaviors, attitudes, perspectives, or people who are not yet older adults, but for whom, aging, for all of us, but for whom aging is on the horizon, and, what are things that they might know or not know, what ways that we can potentially help inform different things related to their health to encourage optimal health as people age. And then we have a question, and this is another really great one, and I'm happy to talk a little bit more about this, about how to find collaborators who are willing to work with people in using these data, because the person notes that there's a lot of repeat authors on publications.
So is it like how to find collaborators to use the open access data, or collaborators for our poll modules?
So it's I'm not sure, and I think we could answer that in two different ways. Do you want to go ahead and take a first stab at it, Matthias?
Sure. So I guess I'll answer it first on our own publications. So our poll team, we have a team of experts that includes people who are both geriatricians or general doctors. So we have kind of like the perspective of a healthcare provider, and we also have people who have background in public health. And so we kind of have a wide range of people. And then we bring in a specialist who brings the questions to us, and they might have even another point of view. So in terms of our publications, they do have quite a few authors on them, because, we're trying to bring together everyone's expertise in both the the design of surveys, but also the topic area of interest.
And, it is an interesting question if you're looking to explore collaborations using publicly available data. Obviously, encourage you to reach out to your networks of people who might be interested. Our reports, as Matthias was saying, and previous academic publications and other publications are available on our website. So if you see one and see the list of authors there and see that someone might offer some expertise that might be of value to you and your research team, you're welcome to reach out to people. We have our bios and some information about us on the website, but we really encourage people to use these data freely for their own purposes. So we do, as the National Poll and Healthy Aging team, as Matthias said, we do release reports. We work with faculty collaborators who are the content experts. We work with them from question development to report dissemination, and then ultimately, ideally, to academic publication dissemination. But we also, we tend to work very closely with people through that process, but we really also welcome whether you're a member of the University of Michigan Institute for Healthcare Policy and Innovation, or you are someone unaffiliated with U of M. We welcome you just to kind of use these data for your own purposes. And again, we're always happy to guide you with answers to specific questions if you run into any roadblocks along the way. I think we've answered all questions that have been submitted so far. I'm going to give everyone one more minute if there's any additional questions before we wrap up today. Matthias, you can move on to the we've got a great question about the role of AARP. Matthias, can you speak more?
Absolutely. So AARP is one of our sponsors, and they have been really great since the very beginning of the poll in helping us to kind of really frame, this idea of asking older adults about their own health and about the things that are important to them. They have a whole research branch there. So you probably know AARP is like the large organization. They do a lot of things, but we work mostly with, I would say, their research branch. Is that right, Erica? Like the folks who are interested in kind of population health and in this.
That's right. We have relationships across AARP, but we work very closely with AARP Research, and they are a sponsor of this poll. They're also terrific collaborators who help provide their insights into topics of interest, support the process of question development and refinement, help us think about dissemination to make sure we're reaching a wide variety of audiences. And it's been a really terrific partnership over the last several years.
Yeah, and they obviously, have a different pulse on kind of issues that might be affecting adults ages 50 and up, since that's kind of their demographic that they serve.
Absolutely. We've had the honor of having National Poll on Healthy Aging results included in some AARP publications, which of course have a really wide reach across the country, which is another obviously very effective means for disseminating these findings to a really broad audience. And then, Matthias, as we're slowly wrapping up here, someone has a question about if there's someone to contact for technical help if they run into any issues.
Yeah, absolutely. Well, let me just, I'm going to pull up our last couple of slides because we have some information about how you can contact us. So here is where our data is available. This is probably the most direct link to get there. And we can put this in the chat as well. healthyagingpoll.org. There's a page that, again, talks about all our data that you can download. But here's a little bit more information as well. And to kind of answer that last question, we have healthyaging@umich.edu. That's kind of our main contact. And if you, write in the messages that, you have some technical questions, that will, get forwarded probably to me, and I can take a look at that and see what information we can provide. And, if we end up getting a lot of questions about similar things, then we can certainly maybe put some more resources on our website to help people understand the data a little bit better and how to use it. But we're very happy to help answer questions at this point.
And we highly encourage people to visit our website, not just to download the data, but also to look at our reports and other publications. We have videos, we have a link to sign up for our email list. We release our reports 8 to 10 times per year and send an email out to those who've subscribed, who get access to those reports first. So we welcome you.
The reports are also just, very excellent. So if you are downloading a data set about a particular topic area, you can also pull up the report and kind of see what we did and the results that we found, and then kind of expand from there into your own questions that you might have. Like maybe you wanted to look at it a little bit differently than how we did. And it can also help, if you're looking at it right. I've certainly answered a few questions from folks who were, I tried to replicate your findings and I'm finding it's a little different. And, we were able to problem solve and figure what was going on with the coding to make that happen. And then this is also the email address people can use if they have topic suggestions, correct, Erica?
Absolutely. We welcome you to reach out to us, whether it's just a topic you think is worthy of further exploration, or whether if you're a University of Michigan Institute for Healthcare Policy and Innovation member and are interested in collaborating with us. It's typically a 4 to 6 month process on average, where we work very closely with our faculty collaborators. Again, I mentioned from the early stages of question development all the way through finalizing the report and academic publication. So we welcome that. We do that. We offer that as kind of a service. It's one of our Institute for Healthcare Policy and Innovation signature initiatives, the National Poll on Healthy Aging. And we really take pride in the work that we do and working closely with experts in a wide variety of areas and backgrounds who help really kind of bring in a lot of enthusiasm, depth of expertise to this project. It's something that we feel very, very proud of, that we're able to be so nimble in researching new topics, to explore areas that really have not yet been explored before, or to take new approaches to topics that have been covered in the past, but maybe we don't yet have enough information about older adults' perspectives on. So we really welcome feedback through our email address with any ideas that people have for how the National Poll on Healthy Aging might be able to help inform conversations moving forward.
Yeah, and before we sign off, I just wanted to thank once again our sponsors, AARP and Michigan Medicine, as well as NACDA, who is the host for our data online, our repository.
Thank you for joining us.
Yeah, thanks so much, everyone.